Hello, and welcome to Practical Tools for Preventing and Addressing Burnout in Academia. This is a public presentation recording on May 24th, 2025, and will also be serving as a guidance for others who are training to become Dragonfly ambassadors themselves, or community champion trainees in one of our many campuses that are interested in starting to build their own internal mental health experts among their peers. So before I begin, I just want to make sure that it's clear that Dragonfly Mental Health is not a healthcare provider organization. The purpose of this program is to increase general mental health literacy and knowledge, and the information provided does not qualify as medical advice and does not substitute for speaking to medical professionals. So today we're going to be going over, I'll introduce myself very briefly along with Dragonfly Mental Health. And we're going to cover the basics of burnout very shortly, but it's important to set the stage. We do go in to more detail of the basics of burnout in our other program. Usually this practical tools follows the delivery of that program. So feel free to check that out on our website if you haven't seen it. And then we're going to talk about the symptoms, causes, and solutions within academic settings, and then apply those very quickly to looking at a toolkit that Dragonfly Mental Health experts and lived experience folks and volunteers who are all academics themselves have put together over the last about year or two with really practical, real tools that people within academic settings as graduate students or postdocs, as residents in medical professions, or as faculty or staff themselves can utilize. So my name is Wendy Ingram, and I am the founder and CEO of Dragonfly Mental Health. I founded Dragonfly about 5 years ago with a huge cohort of wonderful people. But before that, I did train in brain and behavior research. So I started off about 22 years ago now in a biochemistry research lab. I also studied psychology and then went on to get my PhD at UC Berkeley in the molecular and cell biology department, studying the brain immune system and how it interacts with parasites and behavior. And then I went on to study psychiatric epidemiology at Johns Hopkins in the School of Public Health there. So I am a mental health researcher, but not everybody, certainly not everybody in Dragonfly is, and the vast majority of our ambassadors and community champions are actually not experts in mental health themselves, but what we train to do and what we present to our peers through programs like this are pieces of information, evidence, and then lived experience combined pieces of information that anyone can learn to present, anyone can integrate into their own lives, and it'll ultimately contribute to a much healthier work environment and training environment. So over the years, I also, while I was training in brain and behavior research as a researcher, I also created peer-led organizations to address mental health problems, both at Johns Hopkins and at UC Berkeley. But ultimately, by about 2019, 2020, we realized that this really just wasn't enough. Doing kind of grassroots efforts. So that's how Dragonfly was formed. So back in 2020, Dragonfly Mental Health was created by a huge group of academics. It's by academics for academics, and we are a nonprofit based in the US, but globally operating that is dedicated to cultivating excellent mental health worldwide. We have identified 5 domains for excellence that we can influence in our academic environment as non-specialists, as just peers. And that includes creation of wellness committees and peer networks within your department or your school, as well as presenting and regularly providing access to mental health literacy talks like the one we're doing today and skills workshops to build self-support and community support skills. And the final piece of the puzzle really is fighting stigma. So we've also designed and create customized anti-stigma films and facilitate discussions around those within various communities. So with that, let's jump in. We always start with the mental health spectrum with most of our mental health literacy talks. And it's important just to go over and point out, especially if someone's only seeing this particular presentation for the very first time, that mental health, like physical health, is on a spectrum. And so on one end, you have mental health. So this is a state everybody would prefer to be in. You are feeling fine. It doesn't mean that you're overly happy or absolutely perfect in every way, and nothing bad ever happens to you. You don't have a bad moment or a bad feeling, but it generally is a good state where you can interact with your day and do what you'd like to do, work-wise, friends-wise, relationships-wise, and be fine mentally. Stress is something that every single human is going to experience at some point. These can be events. Normal stresses some of them are predicted, some of them are unpredictable and happen without warning. And these are things that are going to cause issues, both positive stress, eustress is something some people talk about, as well as the stresses we usually mostly identify with stress, which is bad stress. But all of those things are a normal part of life. And typically, if you experience a stressor, you can bounce back to that mentally healthy state much more easily, pretty easily, without a lot of intervention, without a lot of time. Whereas as we move along the mental health spectrum, distress is beyond normal stress, where it's easy to get back to that mentally healthy state after a stressor occurs or abates. A distress state on the mental health spectrum is honestly where a lot of academics are, a lot of the time, unfortunately. And so distress states are beyond that quick, easy move back to mental health and ease and flow. Distress is a state where people it is harder to get back to that mentally healthy state, or it's taking a lot more time, or maybe they need to use interventions or take longer rests in order to recover and get back to that mentally healthy state. And a major differentiation here between distress and the next stage along this spectrum is disease. And that really is defined by diseases. Mental diseases or mental illnesses are conditions that are diagnosable by medical or psychological professionals. So you meet criteria for a anxiety condition or an anxiety attack. Something along those lines where, as opposed to someone can be distressed and primarily be experiencing a symptom called anxiety. But if they don't meet criteria for the disease as they've been defined by medical establishments, then it technically would fall into the distressed category, whereas disease is something that's very useful, because when we can know that someone has met criteria for a depressive episode or major depression or bipolar disorder or OCD, these things allow us to have a really good handle on when you're interacting with medical professionals and psychological professionals. They know what works for those conditions very, very well. So some of the same things that help with distress are known and very well studied in disease states to be able to get someone back to a mentally healthy state. So I want to take just a moment here and point out that people with mental illnesses, either one-time or chronic mental illnesses or diseases, can, in fact, spend the majority of their time in a mentally healthy state, so long as they are receiving the right treatment, engaged in the right care. for themselves. And so, same thing as someone with asthma, if it is not identified, treated, and managed over time through medication and behavior and awareness, someone with asthma can still do anything and everything that anyone else who does not have that underlying condition can do. So crisis is the last and furthest on this spectrum, and it is the time when mental health has deteriorated either acutely or over a long period of time to a state where that person really needs help immediately. And they usually are at a place where they can't really facilitate getting that help for themselves. They often need outside support from friends, from family, certainly from medical professionals. So crises might look like a panic attack. Crises might also look like an acute psychotic episode where someone has developed a delusion, where they think that people are out to get them or trying to steal their research, when the evidence doesn't point to that for most other people. It could be someone who is experiencing suicidal thoughts of harming themselves, or thoughts of dying. So all of those are crises, and usually would benefit tremendously from having outside community support. So where does burnout actually fall on this spectrum? It is in between that distress and disease state. It is not technically considered a disease by the World Health Organization, but it is really fabulously well defined and well studied. So we know, we're referencing the World Health Organization. They have a very nice definition that has been utilized by the vast majority of people talking about burnout and studying burnout over the last 20 years or so. And burnout is recognized as a syndrome resulting from chronic workplace stress that has not been successfully managed. And so what that looks like, and what there are three elements that are involved with that, and it's one, feelings of energy depletion or exhaustion; increased mental distance from one's job, or feelings of negativism and cynicism related to one's job or people that you work with. And then third is reduced professional efficacy. So it is negatively impacting a person's life and experience, but because of various reasons of what the actual causes are and what the solutions are, it is not considered an illness, because it's mostly related to chronic workplace stress that has not been successfully managed. So the core components fall into two general categories that you can identify primarily through maybe self-reflection. And so those include emotional or physical exhaustion, reduced emotional regulation. So maybe you're suddenly more quick to anger than you normally are, or quick to tears. Cognitive impairment is an actual, measurable symptom. Reduced memory or attention. So if you're finding yourself reading and rereading an article that you're trying to figure out for your research, and a new method, but you have to just reread that section over and over and over again, that may be a symptom of burnout. And sleeping problems. It does affect people's sleep. The other set of symptoms and core components are things that you might notice more readily in interactions. So interactions in your lab group, or in classes, or when you're interacting with your mentors or trainees, whoever it might be. And increased irritability is a very, very common experience. Withdrawal and distancing, not wanting to participate in work or academic environments and with those people. Definitely reduced performance. Inflexibility as well. So kind of a hardening and reduced capacity to go with the flow or accept other people's ideas. And then cynicism. So if you find that you are experiencing a lot of negative thoughts about the people you work with, or your PI, or different people, or even the work yourself, like your project. You used to love this project and were very passionate about it, and now it's kind of turned to ash a bit. in your mouth. Like that's all cynicism. That's a change in that perspective of people and projects and activities can be one of the symptoms and components. So what's great about burnout is that we actually know a humongous amount about it. And it's been very, very clearly identified that the causes come from chronic stress relating to work or other ongoing activities, a feeling of lack of control over what you're doing, when you're doing it, your time, your schedule, your priorities. Bullying and toxic work environment and or relationships. So I experienced a lot of bullying when I was in graduate school in one of the labs that I was in, and it was very taxing. I was very likely burnt out and did not know it at the time. Work-life balance. So a lot of us end up in graduate school or medical school, and because we're so passionate about the career and the science and the discoveries that could be made, and there's a tendency to put everything you have into that. And so not having a work-life balance, not having a way to break away from what you're doing all day, every day, can and does cause burnout. And then extra job duties, but limited authority to make decisions about what to address and what to prioritize when is a major cause of burnout. A lot of faculty will express this where they're being asked to do more and more and more service for the department or for students or, fill out more paperwork or whatever. And then that can be one of the major causes for having these burnout symptoms. And then feeling disconnected from values is very, very much some people kind of call this moral injury when you're being asked by your employee or training environment to suspend your personal values for the sake of the work. So that can definitely cause burnout as well. And related to work-life imbalance, lack of identity beyond work or the academic environment can cause burnout as well. So I'm just going to point out here that we have an important distinction to make. And I won't go too deep into this because honestly, if you are an academic and you're experiencing some of these symptoms, but you're not sure if it's burnout or depression, burnout and depression do overlap quite a few in many places with what it looks like and what that person is feeling. But typically one of the major differences between depression, which is a clinical disease, and burnout, which is kind of a pretty severe form of distress, but not disease, there are differences. And one major one is that the disease depression, usually when you have the cynicism and the lack of energy, lack of interest, withdrawal, things like that, it's only towards work. Whereas depression almost always will affect many domains of your life. So it will affect you not wanting to spend as much time with your kids or your parents or your friends or different groups that you would like that you can split your time between. So if it's pervasive, it might be depression and would be worth taking a screener. You can look up the PHQ-9 online. There's 9 questions. If you screen positive for a lot of those things, you might want to seek out some psychological advising. You can even talk to your primary care physician about it, though. You don't have to take my word for it. Like, ask a professional. Same as if you were having asthma and you're not sure, is this just, allergies because the trees are in bloom, or is it something more serious that's affecting your breathing? If you're worried, like, go to a doctor, check it out, have them tell you. So same thing with mental distress. So there's also, but one of the things to know is that you can have depression and burnout And you can also have both of those things separately. So they have been studied in a way where it's been kind of dissected as to whether or not like burnout leads to depression. And that they're distinct constructs. There wasn't necessarily a higher rate of depression among people who had burnout first, but now I'm getting into the weeds. So, anyways, suffice to say, it's important that if you have these things and what works for addressing burnout does not address the experience and the symptoms that you're having, then it might be time to definitely to explore other options of what else could be leading to the symptoms you're experiencing. So in the vast majority of environments that we talk to, we will, since this is a public talk, we didn't do a pre-survey, but when we present this to others and local communities, we usually do a survey to see what kind of stresses are people experiencing that could line up with burnout. And the vast majority of the time, almost every single one of these is endorsed by at least one respondent. So there's a lot of stress in academic environments. But when we start looking at the symptoms and the causes, it's very helpful to think about and for yourself. We're not going to do this right now because this is more of a seminar version, but you can take these slides and kind of evaluate it for yourself later. What are your major symptoms? Are you experiencing one, two, or all three of these? And what's interesting about burnout is that you can be burnt out only and exhibiting symptoms in only one of these three domains. It's not always everything. One group that we interacted with, the vast majority of people only had efficacy and exhaustion symptoms, but they had a really nice work culture. And so they didn't have a lot of cynicism reported among their cohort, among that community. So it's also really important to think of the causes and think of them for yourself. They're going to be potentially different for you over your lifetime, as well as from person to person, and what kind of role they're in and what else is going on in their life. So stress and overwork, toxicity, lack of connection or bullying, like what's going on in your life that might be causing these symptoms, and thinking about this: not enough time, do you not have enough resources, do you not have enough autonomy? Explore that for yourself. And you can also say disconnected from values and kind of evaluate, is there a lack of identity outside of work? And would exploring that and lifting that up actually improve your situation? So what helps is also been really, really beautifully defined. And one of the things that's very fascinating about this thing, burnout, is that you can use almost any of these things that have been identified to address burnout, even if you can't get at the root cause of the unmitigated stress. So you can mitigate a certain kind of stress by doing one of these other things. So what is that? Social support. So it's not just about self-care. It is absolutely not about personal resiliency. And that's how it is also your responsibility to be able to deal with all workplace stress. No, 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 no. It is absolutely social support and the responsibility of the environment and the workplace, as much as it can be expected to, take care of people and reduce stresses that are absolutely unnecessary and negatively affecting people in that space. So oscillation between rest and effort is a really, really big one. And it's related to a bigger one later, which is taking full breaks. But even micro rests are really good. Mindfulness, sleep, and exercise. So increasing absolutely any one of these things has been shown to very dramatically improve burnout symptoms and prevent them. And taking breaks throughout the day and longer breaks, like real vacations where you fully disentangle yourself from things, digital detox if you possibly can. just to maximize the breaks that you do end up taking and make sure you do take breaks. Identifying when you work best and then figuring out or getting accommodations and improving your communication with the people that you're working for and with are all really good ways to customize and make things smoother and reduce stress over time and in general. And then seeking and receiving support and building better relationships at work. So not just, being friendly and saying hi and like the nice pleasantries, but when people have deeper relationships at work and with their colleagues or their mentors or their mentees, they typically report much, much, much lower rates of burnout, as well as worse symptomology, even when there's a lot of other stresses still that they can't escape. And then some studies have shown that cognitive behavioral therapy, especially for those who are more in charge of their own work schedule, work environment, who they work with, if you have a lot of autonomy, which many researchers do, that cognitive behavioral therapy can help you address the way that you have your habits that are contributing to you not self-regulating the stress that you're experiencing. So most of these are the same. I'm only gonna go through the details for solutions for faculty and maybe point out a couple of the differences on solutions for trainees or staff. But solutions for faculty or students or staff, it's really important to think about two things: what's in your control and what's outside of your control. And then what can you do about that? So what's in your control can be micro breaks. You can introduce those yourself. You can build those supportive relationships. You can engage in improving your communication with your colleagues and with your mentees through active listening. And you do have a lot of influence on your lab culture. If you are intentional about lab culture and setting it and making sure that it doesn't go off the rails, or addressing issues and conflicts that come up early as opposed to letting them fester and work themselves out. If you're proactive and intentional with your lab culture, that can do a lot for you and for the people that are working with you and training with you. And then doing personal work. So, faculty one of the attractions of being research faculty has been stated that you have a lot of kind of freedom and autonomy once you have funding, of course. But that may mean that kind of constantly exploring that for yourself. How can you improve things for yourself and for others is really good. But what's out of your control is the whole department culture. So one person doesn't make a culture, it's the whole group of people. And some people affect culture a little bit more strongly than others, but you can contribute to that, but you can't necessarily change it overnight and make it just be better. Access to resources. If your university or your campus doesn't have resources available to you or your students, then that's out of your control, but you can get together with others and try to make some noise about getting access to those resources. And then policies in place to effectively train and support faculty and run a modern day lab that's meeting the moment of extreme stresses that all of us have. As well as university support and reducing that administrative burden. These are all outside of your control, but if you've identified that these are the main issues you're facing that are causing burnout, those are things that I would encourage you to get together with others and try to lobby for change. So solutions for trainees may be a little bit different. So thinking about due diligence and choosing a lab, from a trainee point of view, being more proactive in your own communication and boundary setting is in your control. And then things that can be out of your control or still in your control are a lot of similar things. that the faculty are, are in their control as well. And so outside of your control is definitely all the same things that the supervisor or faculty member has, but with you also don't have control over your supervisor's skills or willingness to support you and your needs. So you can advocate for it, you can self-advocate, but it is their responsibility to be proactive in trying to reduce your stress that's unnecessary as well. So staff are very similar kind of things. You can also do micro breaks, build those supportive relationships. If you're in more of a support role, managing upwards is very good. And if you're in more of an administrative leadership role, active listening is quite good as a skill if you haven't, experienced that training or revisited it on a regular basis. And then very similar to what we were discussing earlier for your colleagues that are faculty or trainees as well. So ultimately, what's fascinating about burnout, and this bears really important discussion, is that it's technically based on all of the research and everything we've talked about, it really ought to be more an employer or supervisor responsibility than it is on whoever that person is who's experiencing the burnout. So on individual levels, we see that setting the culture is important, self-educating on others' experiences is important, active listening skills are important, problem-solving skills are important, focusing on very clear goals and establishing and revisiting regularly reasonable timelines and expectations. But on a systems level in academic spaces, there are some other things that we can do. And so advertising local resources is something that the department or a community can make sure is happening more and more. Ensuring access to psychological services as much as possible. Department leadership should be advocating for faculty, for students, for trainees, for staff. That's part of their role and their responsibility. But they can't advocate for you if they don't know what the problems are. So having communication channels for that is also very good and important. And then university leadership should be listening to the needs and meeting them that are coming from the department leadership to the best of their ability. I know that that's a lot harder and much bigger system to kind of rattle the chain on, but technically that's who the responsibility falls on. And following up to ensure solutions that have been tried, have worked, or if there still needs to be more attention. So most academics would consider themselves researchers in some way, shape, or form, or at least a lot of the STEM ones who pay attention to dragonfly are. And so, keep track of your work, treat it like an experiment, and then evaluate the results, right? So I have one kind of two more points to make about burnout in general, and then I will very quickly walk through some of the academia-specific toolkit pieces, just so that all the practical tools are here for you. You've been exposed to them all, at least very, very briefly, and you can revisit the material from this presentation and this talk in order to build your own toolkit. Figure out what you want to try first, what works best for you and your situation and your environment and your career level. And then, be in touch. Let us know what works for you so that we can continue to share this with others. So the final 2 points that I kind of mentioned earlier was that burnout is interesting because, so unlike depression, where if you have depression because of let's just use the mainstream terminology, a chemical imbalance. Um, uh, if you have depression because of something that's very biological and not trauma related, then going to a psychotherapist and doing exposure therapy or cognitive behavioral therapy is probably not going to work very well if you have what is primarily a biologically driven version of depression. Whereas if you have um, another issue, like an endocrine dysfunction issue that's then causing the depression symptoms, that, which is still a biologically driven thing, identifying and addressing that you have hypothyroidism, and that's what's causing depression, and treating that hypothyroidism is probably the only way that you're actually going to get better. Therapy and SSRIs will not fix a hypothyroid-derived version of depression. So check out our scientist primer on depression if you want to know more about the underlying biology and all the different ways that depression can occur and be treated if you like. But so getting at identifying and addressing the thing that is causing medical conditions like depression is usually a very important aspect. Burnout's actually not. It's fascinating to me that burnout, you can continue to not address that targeted thing that is causing it. It does help. Being targeted is very good. But you can also engage in some of these other practices that involve, duration. So duration and or intensity. And then frequency. So these three other aspects will also influence and improve the situation that you're in and the likelihood of developing or recovering from burnout. So again, if you can be targeted to the cause, like you have a bully in the lab and you can get that person to stop bullying you, the more direct, the more effective. But with burnout, some things can be effective even with low frequency and low intensity, so long as you do it with consistency for a long period of time. So if you can do weekly 5-minute meditations, that may be the way to go if you continue to do it over a long enough time. It can have positive influences. Intensity. So maybe you can't take long breaks or have a lot of mandatory, or you have a lot of mandatory events that you really can't schedule around. But can you maximize the opportunities you do have? So can you completely engage in those positive restorative solutions for burnout, or completely disengage when you're taking a break, even if it's a short break or a weekend? And then frequency. So again, maybe you can't target the real cause, or you don't even have the energy at the moment because you're so burned out for deep connections with peers. But can you meet up for a coffee rather than lunch and do that much more frequently? Those can all be ways that you can address things with burnout. And these are the 4 components of change. So a comparison I like to make is between elite athletes and academics. The best athletes in the world train incredibly hard. They give their all to achieve peak performance in their field. But when there is an injury, even the smallest one, the response is to address it immediately, even courtside, for the entire world to see. So we are very privileged to be able to train our minds at the highest level as scientists, as researchers, academics of various sorts. Yet when our minds, the most critical instrument of our work, is injured or strained, we tend to just keep doing what we're doing. Some studies have even shown that people who don't seek help right away when they are experiencing depression or burnout symptoms will wait 6 to 8 years before seeking help. So we need a culture change. And here is now a very lightning overview of practical tools that have been recommended and identified by other members of academic communities. So we asked at a conference last year from a group of about 300 biomedical program directors, what do they do to feel better? Unprompted, no Absolutely no details or suggestions were made, but these were the top ones. So many people said peer support. A lot of people said exercise. Many people said therapy. Time off was a major one. Family was a major one. Friends was almost as high. Having hobbies outside, so that disengagement from work. Having administrative support or very clear boundaries was very important for them to do as well as they do and to maintain their high productivity and happiness. And then mentorship. So people mentioned both they really found value in receiving mentorship and giving mentorship. That was very rewarding and that's building those deeper relationships. A lot of people said meditation as well, and sleep hygiene, as well as nutrition. And then some people mentioned specifically treating mental health conditions, so antidepressants and medications. And then journaling and gratitude as well, which is an evidence-based approach. Um, so one of the things that we can recommend for academics that are very busy is to try to combine a lot of these elements together, all in one thing that can be done relatively quickly, but with a lot of high reward. So we call it a break, and you can be very creative about what this might look like for you or think of other options, but I'll give you an example after I explain the name. So break being, it's got to be brief because we're all very busy, right? Have it be as relaxing as possible. So not a stressful break, but a good thing. Something that's a little energizing, and it doesn't have to be something that gets your heart rate up, but just gives you a little spark, doesn't drag you down. Shouldn't be hard or annoying or you don't want to do it. Awareness, changing your awareness is a really powerful element of a lot of mindfulness practices, which we'll go over super briefly a bunch of those options later. And kinesthetic, so moving in some different way than you typically are moving all the time. So an example that we've come up with that a lot of academic groups have appreciated was that writing a thank you note is really nice. It's a really great way to physically write a thank you note, an actual card, to someone that you work with, taking a moment out of your time. It does not have to be long-winded. It does not have to be a thank for every single thing that they've ever done. Just one thing that to one person briefly to take a moment from what you're doing all day, every day, and write a thank you note to that person and give it to them. You are building deeper relationships. You're expressing gratitude. You are doing something physical that most of us are typing away on our computers these days, not writing with a pen. And so it's brief, but it's relaxing and it's positive, and it's going to be energizing for a lot of people. So next time you're at the drugstore, just grab a little box of thank you notes, have them in your drawer at work, and give it a try. So intentional culture building is really great. Encouraging making space and time for self-care and breaks and vacation by also demonstrating this yourself, whether you're a more senior student or a postdoc or a faculty member especially. Emphasizing that mental health days are just as important and legitimate as physical health days, sick days. Encouraging leaving lab to get out in nature, to exercise, to meditate, whatever it is people do. Um, Leaving lab to eat lunch and socialize with other people, encouraging that really sets culture that prioritizes those things and lessens the toxic overwork culture. And then celebrating diversity of interests and activities. So people that do music or sports or art or volunteering or gardening, talking about those things and not criticizing them or dismissing them because that's not something you do, showing interest in and celebrating other people really creates a positive culture. Um, Another thing to intentionally build culture in your lab or on your campus or in your department are through fostering team spirit and collegiality. So group activities and lunches, recognizing and encouraging camaraderie as a very important part of work, not just publications, but who's collaborating and giving each other credit. And then if there's an obvious conflict, especially anything that smacks of bullying or harassment, if you're a faculty member, it is your job to be proactive in the conflict resolution. So the longer you leave it, the worse it's going to get. And prevention is worth a pound of cure. So another concept that a lot of people ended up, surprisingly to me, saying was that another way to build community and reduce workload stress is to do practical task sharing. So if there's parents among the faculty or postdocs or graduate students having sharing caretaking responsibilities, coordinating with others so that not everybody has to, maybe everybody gets 1 day a week where they get to work late or something by co-parenting a little bit and babysitting for each other. Combining lab or departmental events and meetings. So especially mental health, culture, or DEI topics is nice. And then writing cooperatives is something that a lot of people have said was really positive, especially for the people that aren't as outgoing and don't want to socialize in a really, really active and direct way. They can just gather and be working mostly in silence with each other, but that still builds camaraderie and appreciation for each other and deepens relationships. Meal sharing plans and pet play dates are other ideas that Dragonfly volunteers suggested as well. Vacations, they really should be enjoyed. So to the best of your ability, we encourage no phones, no emails, no expectations. And if you have the ability, put someone else in or anxiety around leaving the lab or leaving your project, have one person be a point person that if there is something that really needs to get your attention, that person knows how to get in contact with you. But that way you're not the one screening who needs what and whether it does truly require your attention. And I want to reiterate here that the consequences of not taking breaks is worse than taking breaks. So you may not feel like you don't have time, that you do not have time to take those breaks, whether they're really small ones or bigger ones or weekend ones. Not taking breaks causes burnout. This is abundantly clear from the research and literature. And then it drops you into this burnout cycle where you experience social withdrawal, lack of concentration and efficiency. That makes the work harder and more stressful. That increases your exhaustion and then exacerbates the cynicism. So taking breaks actually saves you time. And if you need to write that out and paste that on your desk to remind yourself, then that is something you should do. Active listening skills are a phenomenal way to improve communication in every single context. So cannot suggest it enough. And Dragonfly does have a free online brief active listening overview. We also provide the workshops that are 2 hours long where you actually practice those skills with real world scenarios and prompts. Another really important thing to do, especially if you're in a place of authority in any way, shape, or form in that structure in academia, is to self-educate about other experiences. So this can really, really help with communication and support and belongingness. And asking those people directly is actually somewhat harmful. So that's one of the things that's included in the definition of a minority tax, where asking historically marginalized people in the United States to discuss less common experiences is asking them to relive every moment of pain, fear, abuse, and/or outrage that they have experienced. So the best that you can do to help them and help you understand is to try to self-educate as much as you can and be very respectful of their legitimate disinterest in spending their energy on your emotional well-being with regards to something that for them is their everyday experience. So those are good. These are five really fabulous books. Tomorrow Will Be Different by Sarah McBride is on someone who is a trans person. An Unquiet Mind by Kay Redfield Jamison is a wonderful memoir of an academic researcher and clinician who also experienced bipolar disorder. My Grandmother's Hands is a wonderful book by Resma Menachem, and Bury My Heart at Wounded Knee is a very good book recommended by a lot of people that I know who are Indigenous. And Just Human is a very short but beautifully written book that's half memoir and half research, is kind of summaries of her own research of someone who is born congenitally blind and is an expert on disability. So one thing to remember is that disclosure in almost every case is never required. So participate in trying to create a safe environment. Key is to facilitate conversations about what people need to be and do their best without needing to know why. So if someone asks for being able to come in at 10 every morning, but they're going to get all of the work done and or stay later, like if that's the way that they work best and it doesn't actually impede the ability of everyone else to work and do well, and you can make that accommodation, you really don't need to know why. You don't need to know, ask them if they, have therapy every morning, or that their workout routine is just very important, or they've figured out that their circadian rhythm just, they function best if they're not in lab and working at 8 a.m. If they can take their time and get there at 10, but then stay a little later and they still get everything done, like it's not your business if you can accommodate it and there aren't other outstanding reasons why they would need to be there earlier than that. So respect privacy and boundaries to the best of your ability, and allow people to disclose to you as they choose. And then from that disability wisdom book is an absolutely fabulous collaborative problem solving framework. She just calls it Stop, Ask, Listen. The details are here, but it's a great book, and it's a great communication strategy and kind of mentality when you are trying to address things for people. And then another thing around communication is to think about that communication continuum. And basically, there's kind of, you can break it down into three of passive, where people they're very, very passive and they're allowing others to violate their rights. Others always come first. On the other end are people that you might, or an orientation that might feel aggressive, which is where someone is violating others' rights and their own needs always come first. And ideally, in the whole human spectrum, most of us would prefer this happy middle ground of assertive. So you can respect others' needs and your own needs. So when we have this hierarchical system that we're all in academia, the trainees, might be passive, but they really ought to be assertive if they can. And then when, a trainee is aggressive, that usually results in a very bad dynamic. Unfortunately, supervisors are also kind of on this spectrum too, in a natural range, but could be improved, that a lot of supervisors are avoidant. So they don't want to say the wrong thing. They don't want to be overly involved in situations. They might want to, be respecting people's privacy and boundaries. But if it errs on the side of avoidant, then the trainee really doesn't feel like they're invested at all. Whereas, there are overly invasive supervisors as well who do want to know everything that you're doing and do make a lot of demands of people without giving any respect for what might work best for the trainee. So meeting in the middle of being an invested in supervisor and having assertive trainees and rewarding those kinds of communication dynamics is a very good thing. So that all just has to do with another fabulous set of skills that we encourage and have adapted specifically for academia in our Managing Upwards workshop. But it involves doing all of these things, and it's freely available online as well. And then I can never say enough about clear goals and reasonable timelines, but for time, I will not say very much about it. Basically, setting goals, being reasonable, and then revisiting those goals and timelines regularly is just so critical to reduce and avoid burnout. And just, I know it's been 5 years now, but there is no catching up from COVID. And what's going on today, there's not going to be catching up from that either. So we just have to reset and revisit and let things go that are not achievable, and then go from there. And that needs to be done on a regular basis. So mindfulness is absolutely wonderful. This is kind of a joke slide, so you can read that later, but it really isn't the way that it's portrayed in like movies and mainstream and stuff like that. Mindfulness is an incredibly scientifically studied and proven set of skills and approaches that dramatically decrease stress and anxiety, improve focus, improve decision making measurably, and improve sleep. So Johns Hopkins mindfulness-based stress reduction programs have actually been created by and for faculty. So check that out. They have a ton of workshops, short and long, you can sign up for, but also many, many, many do-it-yourself on your own time resources. So that can involve guided meditations, 3 breath breaks, and different alternatives to breathing breaks, grounding practices, standing stretches, seated stretches. You can also bring your attention to your senses. It's like spectacularly simple in a lot of these practices. So it actually makes it incredibly easy to do, but they are effective. Pausing before transitioning to a new task, pausing before picking up your phone, catching yourself when you're on autopilot, and labeling emotions. So there's a 3 breath break. There's also square breathing. You can look that up. It's exactly what it sounds like. And then 4, 7, 8 breathing, as well as just breathe 3 times and focus on that and only that for those 3 breaths. And then you can go back to work. And that is a mindfulness-based approach. This is the 5, 4, 3, 2, 1 grounding practice where you engage your senses. You can do seated stretches such as this. You can do standing stretches where you do get up out of your chair and move around a little bit. And then let's emphasize the fact that faculty are the ones who have the biggest influence on culture. So if faculty don't know the local resources, they really do have a responsibility to seek them out and share them with their teams through a variety of means. Posters in the lab, links on your website or on emails that go out, just make them easily accessible, both discreetly and publicly. Normalize help seeking, and you and your lab are going to be a lot better off. Mental wellness support centers will often provide confidential consultations if you are a faculty member and you're concerned about people on your team. And they may even be able to provide coaching on exactly how to address issues that are outside your purview or experience. And supporting students, family members, colleagues, or friends that are struggling or having a hard time can definitely be taxing on you too. So seek your support for yourself when you need it. And then advocating and following up. No matter where you are in the hierarchy, it's really beneficial to ask for resources and then celebrate successes in the lab or in your team. Celebrate your own successes too. Maximizing any kind of motivators that are unique to your group and your cohort will build lab spirit and build resilience to the stresses that are inherent in graduate school and research. And then following up. So not every solution is going to work the first time. So if you do refer them to a resource, it is perfectly reasonable to check in and see if it panned out and helped. You don't have to get into like long sessions about it, but just quick check-ins are worth a lot. So at University of Arizona or University of California, Berkeley, there's a number of graduate student resources, the MCB Grad Network, and then for all trainees. And there's a wellness committee there that is been working with Dragonfly for the last couple years to address a lot of issues. And so these are all really great things for whatever your situation, whatever your campus, your department is. If you don't know the resources that you have available, start asking around, collating them, and advocating for them to be made a little more public and mentioned a little more often. So thank you very much. If you are watching this online and you would like to give us a little bit of a review, that would be amazing. And I would say, use this QR code and the Dragonfly survey tiny URL to just answer a few questions, just very few questions. It'll take you 1 or 2 minutes tops, but it dramatically helps us improve things so that we can provide support and to our fellow academics to the best of our ability. So thank you so much, and we appreciate your time.